Welcome to Fellowship Safaris, conversations about people of color and their journeys to subspecialist training in their countries of origin and around the world. Hi everyone, and welcome to this week's episode of Fellowship Safaris. My name is Dr. Jerry Kariajahe. I'm a consultant pediatrician and adolescent medicine specialist. And this week, I get to have a conversation with someone who's been a mentor and I'd like to believe also a friend who I have been learning from for very, very many years. And I was so glad when I actually convinced him to come to the studio. I don't want to get too far ahead of myself. I'd like for him to introduce himself and his professional qualifications.
Well, I am simply Joe Mbuthia.
Yeah.
The middle name is Kahiu, so Joseph Kahiu Mbuthia.
Mm-hmm.
I'm a pediatrician. I got my MBCHB in 1979.
What?
Were you born, Jerry?
No, I might have been a thought in someone's mind. What?
Yes,
Yeah.
79.
Yeah.
My MD Pediatrics 85.
Wow.
And
You've been practicing peds from 85?
85.
Wow. Okay.
Yes. And then my pediatric infectious disease in 2017.
Whoa.
Yep.
So 79, 85, 2017.
2017.
Hoping that that's not the pin for you.
There may be more to come.
There may be more to come.
Yes.
That's amazing. Thank you so much for honoring the invitation. We're really humbled and privileged to have you here. I actually just want to jump right in and ask, did 7-year-old Joe see himself where you are today?
Maybe not.
Yeah.
I'm the middle of 8 children,
Mm-hmm.
the middle born.
Yeah.
A little cheeky in my childhood.
Uh-huh.
My mom tells me that I walked before I had teeth in my mouth. And I stood, walked, and ran all in one afternoon.
What?
Yes, my dad was home for lunch.
Yeah.
He went back to work. By the time he came back in the evening, I was doing loops around the house.
What? You had all 3 milestones in an afternoon.
So
Yeah.
the makings were there.
Yeah.
The dream may not have been concretized,
Yeah.
but I sort of was a very fast kid.
Mm.
My mom would describe me as, if I use Kikuyu,
Yes. Go ahead.
we muhiu tadhathi wa gigi. You are as hot as locust soup, which I had never tasted.
Yes, I was going to say,
But
how hot is that? Yeah.
I mean, I was very impulsive,
Yes.
kind of hyperactive.
Mm-hmm.
Yes. So the makings were there, perhaps.
Yeah.
I found class lessons easy when guys were struggling.
Yeah.
I just didn't get it.
Why? How can you be struggling? How?
Yes. In our days, because we didn't have primary nursery school,
Yes.
class 1, most people used to repeat. And my elder siblings would tell me, you're likely going to repeat this as we did.
Yeah.
Because you have to know your spellings, your numbers.
Mm-hmm.
I did it first time round.
And that was it.
That was it.
What? So you must have been the youngest guy in your class from there. If people are repeating as they go.
Yeah, actually, having been born in March,
Yeah.
I went to school before I was 7 years. And that was the standard to get into primary school.
Yes.
When you are 7.
Oh, it wasn't the one for touching your ear?
That was also an added
thing. Yes.
But I go to class a little younger than my peers.
Yeah.
But I just sailed through.
Yeah. Oh, wow. And so as you were going through your education, when did that dream of medicine, when was that passion sparked? When did that dream start being that thing you're seeing, I could do this?
Jerry, you'll be surprised.
Mm-hmm.
It may be never.
What?
Yes. Let me just backtrack a little and say I was born in Kagema, Muranga, a village called Kairade.
Mm-hmm.
hilly and green, with both tea and coffee. It's somewhere near Abadeas, but you can also see Mount Kenya. So it's a land in between the mountains.
Yes.
And I went to high school in Kangema High School. I was the littlest, to the extent that the Form 2s who are doing the modernization called me molecule.
You are that
the
small.
molecule of the school.
The molecule of the school. You are that small.
In the scientific sense of the word.
Yeah.
So we did something called physical science.
Yeah.
Which was biology, physics, chemistry all in one.
Yeah.
And I sort of found that very much fun and easy to do. So your marks determined where you are admitted in Form 5 and 6.
Yes.
These were the Cambridge days.
Yeah.
And so I got admitted to Alliance. Can you imagine?
Nice.
Kagema Secondary to Alliance High School.
The Alliance, as people call it this day.
The high school.
The high school.
The high school.
Before it used to be called just the high school?
Yeah.
Oh.
Which other one was there? Tell me.
Okay.
The high school for boys.
Oh, the high school for boys.
Yes.
Okay.
And so for Form 5 and 6. Now, there you go and find doing segregated subjects. I have biology, physics, and chemistry separately. Math and English and general subject as subsidiaries.
Yeah.
And, it's struggle with orientation first for city. A big school. Everyone wants to excel. It's hard work.
Yeah.
There are new concepts that had not been introduced to me in physical science that were there in, for instance, physics and chemistry. But come the end of Form 6 exams, I think I topped in biology the country, the whole country. Yes.
Wow.
And physics was so very good. And I mean, all the science, I did very well.
Yeah.
Then the selection for universities went like this. Not what you wanted, but they picked the top in sciences were admitted to med school.
Automatically, you want us...
The top number.
Yes.
If med school wanted 130,
yes,
the top in sciences ranked by their marks, 130 into medical school.
Not by selection. This one that we are assigning and writing places.
You could do that, but it was overridden by how marks were scored.
What?
Yes.
Okay.
So we found ourselves in medical school. My dream was actually always to be an electronics engineer because I found gadgets very fascinating.
Yeah.
First of all, at Form 4 level, I had applied to go to Kenya Poly because I thought that you could go and fiddle with things.
Yes.
Because you could go and now doing electronics.
Yes.
My brother tore my admission letter because he thought there were better things to come.
He was like, what is this guy at Kenya Poly? How now?
How?
So your dreams of electronic engineering ended
I later learned that I'd been admitted to Kenya Poly years later.
Wow. Oh, was it gut-wrenching or by then had you settled
we laughed about it.
What? Yeah.
And so medical school, the first week was a shock.
In what way?
The anatomy guys, I think they had colluded with the vet guys.
Yes.
To bring in a monkey and anesthetize it.
Yes.
And slaughter it in front of us.
Yes.
Dissect it.
Yes.
We dissected frogs under formalin in biology.
In biology
but
class,
now a live monkey.
Yeah.
I don't know the shock tactics, perhaps to see who would flee.
Who will actually stay of this 130? Of this 130, who will leave?
Yes.
Wow.
And I actually left. It was so gross.
Yeah.
I took off. I would sneak back. This was orientation week, so it was easy. You could go back in.
Yeah.
Yeah, but after the orientation was over,
yes,
things became a little more sane and classes began.
I hope no more monkeys.
Nobody dissected a live monkey.
That is horrifying.
With blood.
Oh my gosh. Oh, I can't even imagine.
It was gross.
Yeah, because anatomy as it is was very scary. Just having the cadavers
the
there.
whole of cadavers.
But then also the cadavers have been drained of blood. Like they're not, you don't cut and have, this sort of...
Actually,
they'd been drained of blood. So having a monkey and blood, I can't even imagine.
It was horrendous.
Yeah.
But anatomy was hard.
Mm-hmm.
We were grouped in sixes, 3 on each side of a cadaver. I don't know whether it was the same.
It was a bit more.
And we were
our class was big.
We were grouped alphabetically.
Yes.
I was next to a guy who was a Canva person.
Yes.
Who was very good with his hands. You know how good they are at carving.
Yes.
So I never had to catch a scalpel. I was reading the directions.
You were reading the directions, attached. Oh, you was very lucky. You're very lucky.
Yeah.
Yeah.
So I found myself in med school.
Yeah.
By achievement, but not by choice.
Mm-hmm.
But when I got there, I got to enjoy, especially anatomy.
Yes.
Just finding out how the human body is and how the human body works.
Yes.
Physiology. And I really enjoyed the basic sciences.
Yeah.
Yeah.
Oh my, that's such an interesting journey into med school. And while, after finishing med school, how did the story around pediatrics come about?
My natural self.
Yes.
My nephews and nieces started to come.
Mm-hmm.
Actually, they were little when I joined med school.
Mm-hmm.
And I would spend holidays with them. And I just loved being with them and making them happy and just playing with them.
Yes.
Yeah. Sometimes they've been left in my care.
Mm-hmm.
And we had fun.
Yeah.
So I sort of knew if I ever had to choose, I would be happy near children.
Mm-hmm.
Yeah.
That was your choice. And thank you to your nephews and nieces, because if you hadn't been having that much fun with them, this would have been a different story. So shout out to your nephews and nieces. I'm hoping they'll be able to listen to this conversation.
Hi, guys.
Hi, guys. So what was the landscape like in terms of practicing pediatrics in the 80s?
I'll tell you. During the training, there was this very, very busy and hectic place called pediatric casualty.
Yes.
There were long queues. You had to work pretty fast. The conditions were not nice at all. Yeah, you just had to sit there and have the convulsing kids thrown at you.
3 of them at the same time. Usually it was not one at a time.
Yes.
Yeah.
And you had to think fast, act fast, be good at your skills.
Yeah.
The equipment, of course, wasn't that great.
Mm-hmm.
But I think the most memorable thing that you guys may not have seen was kwashiorkor. Kwashiorkor marasmus. Those were common things.
Wow.
And difficult ones at that.
Yeah.
And there was this malnutrition room with heaters.
Yes.
And there would be deaths. 3 a.m. in the morning was the worst hour. Nurses would go taking their vitals and just find cold kids in their mother's hand. The mother dozed off and the kid
passed away. Wow.
It was a difficult time
to be practicing kids.
Yes.
Wow. Because I think even for us now, even when we were, training in pediatrics, yes, we'd still see malnutrition, but not at the scale at which you're describing. And so for the pediatricians of the day, I'm guessing you are seeing all these things at a much bigger scale. What are some of the ways that you try to partner with community or try to partner with other healthcare professionals in terms of helping them manage it? Because I'm guessing not everyone could come to the national referral space.
I would say there was the structure of healthcare then was Kenyatta was the national referral.
Mm-hmm.
Each province had a provincial hospital.
Yes.
And down below the provincial hospitals were district hospitals. I may go back and remember the days of my internship.
Yes.
When I was posted to Kisumu,
Mm-hmm.
and I just went there with a backpack.
Yeah.
On my, and some 2,000 shillings as impressed.
Yes.
Now, when we went to pediatrics,
Yes.
my first morning in the under fives ward, 5 kids died before lunchtime.
What?
Of the same things: malnutrition,
Yes.
kwashiorkor marasmus, and also those were the ones with gastroenteritis, the most severe form of gastroenteritis.
Yeah.
And therefore, before you could find a line or whatever, they just kept dropping off.
Wow. What?
Yeah.
That's very dramatic for
I went
your
back
internship.
to my room,
Yeah.
to my house for lunch.
Yes.
And I just didn't have the spirit to go back in the afternoon. It was horrendous. I mean, just 5 mortalities. And if you've worked in Nyanza,
yes,
you would know how death is mourned. There was screaming and mothers just running up and down the corridors, wailing. Yeah. So one is wailing from this end, the other one starts wailing from that end.
Yeah.
And the wailing in Zulu, I couldn't understand much of it, but I would think they were heaping blame on us. Wow. It was hard. Yeah. Very, very hard. But yeah. Colleagues encourage and just keep on keeping on for the one that you can save. And it was sad to see them just keep dropping. Yeah. And therefore, I think the public health aspect of things may not have been as good. Yeah. And the intergovernmental agency working may not have been as good. Yes. As for the NGOs, perhaps there was just Red Cross, which distributed powder milk. Yes. And UNICEF to a small extent. Yeah. But we didn't have the support of the NGOs in communities as we do today. So, mortalities were high. Yeah. Yeah.
So what I'm hearing you say is that this scene was very busy and very discouraging at the offset in terms of the burden of illness, the burden of disease. What kept you going as a pediatrician? Now you've graduated in 85. There are these big numbers that we're seeing of so many children who are going through that. What kept you motivated to continue? Because I think one of the things in peds that I absolutely love is when children get better and, they're able to run around, in a day or two, and they're so pure in there. Now I'm fine. Now I can go, and do these other things. So what kept you going?
I think that's the main motivation, Jerry.
Yeah.
The good number that get well. Yeah. And they leave hospital smiling. Yes. With their mothers with cheerful faces. Yeah. Those are the reward. Or perhaps later you meet with them in the streets with their mothers and they say, Doc, you saved this child. This one was born at 1-point-something kilo. Yeah. You saved this child's life. Yeah. Of course, not alone, but you contributed something. Yes. That is the reward, Jerry. That's what keeps one going. Yeah. Yes.
Oh, wow. And I think in all these years, as I've been going towards pediatrics, I think we'd see very many iterations of that where people would be like, Dr. Mbuthia is our doctor. Dr. Mbuthia is the one who did this, and now this baby, I remember scenarios where, you're told, no, this baby, the dad used to be taken care of by Dr. Mbuthia, and so now we have brought, the baby of the former patient to also be taken care of by Dr. Mbuthia. And I was just like, wow. And I think at that time, you and I had a conversation for how long have you been practicing if now this pediatric practice is multi-generational?
Yeah, exactly.
Yeah.
Yeah.
Oh, wow. And it's really something to aspire to. I wanted to ask, as you were practicing as a pediatrician, could you tell me a little bit about getting involved in Kenya Pediatric Association? Where did your interest about it come about, and where did you guys start off? Because I hear different stories of the early days of the Kenyan Pediatric Association.
Okay. Now, we were interested in the affairs of Kenya Pediatric Association as medical students because during our dissertations, we were encouraged to read the papers at the Kenya Pediatric Association conferences. So our supervisors would help us prepare.
Yeah.
And a few of those dissertations would be picked for the conference. And therefore, you start getting involved at that level.
Yeah.
And you just join as a student with no fees. So when you graduate, it's easy to then just continue being a member.
Yes.
So I could say I've been a member of the Kenya Pediatric Association from my student days.
Wow. Let me just uza myself and say I wasn't even born yet.
So
that's amazing.
It took long to graduate because you remember it was the year of the coup.
Yeah.
So no sooner than we'd started, the coup happened.
Yeah.
And the course was suspended for a whole year.
Yeah.
Yeah.
Wow. So in that year, just out of curiosity, what were you doing with yourself?
Work in Kenyatta.
Yes.
Yes.
Okay.
As registrars.
Yeah.
Very busy.
Yes.
In fact, during the coup time, we were cordoned in the hospital. We were actually surrounded. That was the first place the government secured. The army came and surrounded the hospital.
Yes.
We lived in the registrar's flat, and therefore there was no going in or coming out.
What? This is doing your PEDS
residency. Drama.
During the coup.
During the coup.
And that was the order of the day during that period of time?
Yes.
What?
Yes. And that time you had to do without your consultant because they're at home. They couldn't come.
And there were no mobile phones.
That whole time, the hospital is managed by the registrars.
What? So how did you get in touch with the consultants?
You do what you can.
Where?
You do the best you can.
Yes.
Guided by maybe the senior registrars.
Yeah.
Those who are just about to graduate.
Yes.
Yeah. And the very experienced nursing staff.
Yes.
Yeah.
Oh, wow.
We held the fort.
Yes. You held the fort for that period of time.
Yes.
Wow. Thanks for sharing that because, just having that insight into that experience is quite valuable. So fast forward, you've been practicing as a pediatrician and you have talked about doing infectious disease in 2017. This is after having graduated from PEDS in 85. So what made you think about infectious disease as an area of specialty?
Okay. Let's go back a little bit and say my involvement with KPA.
Yes.
So 85, after graduation, I also got married in the same year.
Okay.
And our daughter was born.
Yeah.
The same year. It was my best year, 85.
Yes. Oh, wow.
I got offered a job with Nairobi Medical Center. I worked for them 6 months.
Yeah.
And then left to be on my own.
Wow.
Very bravely.
Very brave because going into private practice is not one of the things that a lot of people like talking about.
Let's say I was thrown into the deep end and I had to swim.
What? How was it starting private practice at that time?
A very good mentor of mine held my hand. He's called the late Professor Hilary Ojiambo. I was fortunate to have made friends with him.
Yes.
Because he taught me the finer things of private practice.
Yeah.
I used to spend time when I was a registrar. When I had time, I used to go to his clinic and just spend time, watch him work. Very polished gentleman.
Yes.
The physicians of those days.
Yes.
In alligator shoes, pinstripe shirt.
Yeah, pinstripe suit. Yes.
And a hanky in the jacket pocket. Cufflinks, gold.
Did you take on the image of that physician with the alligator shoes?
I was a poor learner.
Because I'm trying to imagine you in alligator shoes and the cufflinks.
I was a poor student, but
Yes.
the things I learned from Professor Hilary Ojiambo
Yeah.
are things you didn't learn in medical school.
Yeah.
Like treating the patient as king.
Mm.
Yes.
Mm.
Also to listen. He told me, if you want to be a clever doctor, be a good listener.
Mm.
Your patient will tell you the diagnosis.
Yeah.
And that wisdom has served me very well.
Yeah.
So Professor Ojiambo
Yes.
went on to a UN job, WHO job, and left me manning his office and told me, Joe, what you need to do, pay the rent, pay the receptionist, the rest is yours.
Wow.
Yeah.
What?
So it was made for me. I owe it to him.
Yeah.
Yeah, that's how it started.
Wow.
Yeah.
That's amazing. And I'm so glad that he was able to mentor you and also just give you the platform.
Yes. So some years later, at a pediatric conference in Nairobi Hospital, two friends of mine, Fred Were and David Githanga, approached me and told me, look, we want to take this thing from the Department of Pediatrics because it's not serving us well. Let's try the private sector as heading the pediatric, the Kenya Pediatric Association. Fred and David, if I've let out the cat from the bag, that was the beginning.
Wow.
So these guys campaigned and I was elected as chair.
Yes.
And that's how we started organizing conferences with the involvement of industry, interesting colleagues. We took the first one out of Nairobi to Mombasa.
Yeah.
And we've never looked back.
Wow.
And we've kept on building from that.
Yes.
Yes.
For me as a pediatrician, years later, who comes in and finds there's order?
So now going back to your question of I got interested in ID.
Yeah.
You remember the late 80s?
Yes.
And the HIV pandemic? Yes. So that took my interest. We kept asking, what can we do for these kids?
Yeah.
Who are unfortunately born with the infection. And I kept learning of things that could be done one by one. The AZT, the very toxic drug that came after that, like D40, Stavudine, DDI, toxic drugs, but they kept people alive. And Dr. Wanjiku Kahiu, she got me interested in treating kids with HIV, particularly those who are in Barnardo's. And Barnardo's was able to get medicine for these kids.
Yeah.
So going to conferences, international conferences in HIV, pediatric HIV in particular, I came to know that I'm quite deficient, and if I needed to understand things a little better and contribute more, I'd better get back to school. So I ventured. I went to some of the International Society for Infectious Diseases, ISID.
Yes.
And World Pediatric Infectious Disease Society conferences. Yes. I found a course advertised for a diploma in pediatric infectious diseases, hosted at Oxford. Yeah. I took the brochure home and looked at it a little bit further and thought, why not? Yeah. I'll apply. And so I did and got admitted in the class of 2014. Yes. Yes.
For a lot of people right now thinking about programs, I've had some people saying, I'm too old, or I've aged out of now going back to school to study. Was that ever a thought that crossed your mind?
Not really, no. Because I knew I could still learn. Yeah. And I wanted to learn. Yeah. And I wanted to do things better than I used to. It took a considerable amount of investment in money and time. sacrifice.
Yeah.
But I needed to do it. When you see everybody is getting a subspecialty, this, subspecialty that.
Yeah.
I was kind of feeling left behind,
Yes.
It was time to...
Even
at
you
least-
get a subspecialty.
Me too, yeah.
Me too, man.
Yes.
Yeah.
One can never be too old to learn.
Yeah. Hey, say that
Unless
again.
you want to get demented.
Ah.
Yeah, if you want to just sit back,
Yes.
waste away.
Yeah. Then that is the route you take for I'm
That's the
not
route you
learning
take.
anymore. Wow.
Yes.
That application of learning,
Yes.
if you don't mind my asking, how old are you when you were starting?
I was in my 60s.
And I love the fact that it was in your 60th year that you were doing this. And now I think it's very difficult to be in a space where there's an infectious disease or HIV consultation where we don't request for yourself or for one of your colleagues in infectious disease to come help, because now we can't function without you guys.
Yes, I think when you don't have someone,
Yeah.
you don't know what you're missing.
Yeah.
But when there's that capacity and that becomes available to you,
Yeah.
you then know what you're missing, just like the internet.
Yes.
Before there was internet or even cell phones,
Yes.
we managed with beepers and
Yes.
telephone booths.
And you time and you're at the telephone booth at a
Yes.
particular time to
Yes.
get the call. Yeah.
Until the cell phones came
Yes.
and the internet came.
Yes.
And now we can't do without them.
Yeah.
Yes.
Yeah. And the same applies for infectious disease. When you think about your learning experience, I know you said there was just learning how to learn again and just investing in that. What were some of the highs during the course of your learning?
For me, it was just realizing how much I needed to know.
Yeah.
The knowledge that I didn't have, the knowledge gap
Yes.
that I had.
Yeah.
And the level at which people who can be called infectious disease specialists are at.
Yeah.
And also the gap between the developing and the developed world in terms of practice.
Yes.
And just capacity.
Yeah.
So those are mind openers, and especially the knowledge gap.
Yeah.
And I would say it's easy to think that you know when you don't know what you don't know.
Yes.
Or you don't know that you don't know.
You don't know that you don't
So
know.
when you get out there and
Yeah.
find out just how much there is,
Yeah.
how much knowledge and information, and you just get amazed.
Yeah. And while you are learning all these things and they're shifting how you're practicing and shifting your view of medicine as we know it, are there some low points that you experienced during your fellowship or during your training?
Yes, there are. I met with my first failure.
Oh my gosh, that's usually a
That
tough
was the
one.
first time I flunked an exam.
Yeah. Ever in your life?
Ever in my life.
Yani, molecule, bullet, Mbuthia.
Everything.
Yes.
Yes.
What?
Very, very humbling.
Yeah. This
Now,
was your first failure
the
of an
first
exam
failure.
in your life?
Yes.
Where?
Now, my ID training, the diploma I sailed through very well. The dean called me after that, after our results, and told me, hey, would you like to move to a master's in pediatric infectious diseases?
Yeah.
And, he interviewed me for it.
Yes.
I said yes. So he set up an interview, set the interview, and passed the interview, and enrolled for the master's, which was a 1 year program. That was in 2015.
Yes.
Now.
Yeah.
2015.
Yeah.
And that meant going to now what is called matriculation, enroll into Oxford University now as an Oxford University student, get enrolled into assigned a college. I was assigned to a college called K-Log.
Yeah.
And learn to do things Oxford way.
Yes.
I chose to do my master's as a written paper of systemic analysis of data and writing a meta-analysis.
Yes.
I chose to do pharmacovigilance one on vaccine research. So I was to collect data on the African vaccine research studies that have been done.
Yes.
And conduct a meta-analysis on severe adverse events that have happened. A big topic, very exciting.
Yes.
And I worked on it.
Yeah.
But during the year of writing, my elder brother passed on.
Wow.
And that just took a knock on me.
Yeah. This is your elder brother who had torn up
the
Kenya Poly.
The same.
Oh, may he rest in peace.
So I go into mourning.
Yeah.
And I'm also finalizing my dissertation. A lot of time was spent. Now, he was the leader of the family, and I had to take the lead. So I didn't do a very good work at preparing for that exam. I thought I could do it. I went and set for it by submitting my dissertation. First, I was late to submit. Some mishaps during travel. My computer got lost during airport transfers. So I had to just buy another computer, retrieve data. Chaos.
Yes.
So it wasn't accepted. First, I was punished for submitting late.
Yes.
So marks were knocked off.
Yeah.
And the marks were low in the first place. So it went into a fail.
Yeah.
Yeah, my first F.
Wow.
So I dusted myself.
Yes.
Said, now let's work.
Yeah. What?
Went back to my supervisor. He pointed out the flaws. And we worked on it.
Yes.
And it turned out a very nice paper.
Nice. Hey, Yani, that low was very low.
It was
That's what I was expecting. I was like, what? Years later, when you finish the diploma and your master's as well, what words of advice would you give somebody who's thinking about going into training, whether it's infectious disease or just subspecialty training? What would be your nuggets of wisdom for that person?
I would say go for it. Go for it and don't look back. Whether it's a big investment or you get sponsored, just go for it. Learn. It will be for your good in the long run and for the good of the society. Be able to serve better. Yeah. Our profession is a call to service. That's how I see myself. From Alliance High School, the motto is strong to serve. So learn and be strong to serve. So thing that will help is self-discipline. Just control yourself and put time aside. Yeah. And you'll do it. It helps to have a good family like I have. Yeah. A supportive partner like Wambui. Yes. Shout out, Miss Wambui. Shout out. Wambui is gifted with the ability to sleep with the lights on. Hey. That's a special. Yeah. Yeah. I've always had my study desk in the bedroom. Yeah. Where I can see her sleeping. Where you can see her sleeping as you study? Oh, okay. Just knowing she's there. She's there. I am not alone. I am not alone. Yes. Yes. It works very well. Yes. And by the time I was doing my Oxford, the kids were grown. Yeah. And it was also good to have kids that encourage you. Yeah. I also wanted to put a higher bar for them. Yes. Stephanie and Claire, are you listening? You better listen, Stephanie and Claire. Wow. Yes. Yes. Just before we wind everything up, you are a man of faith. Definitely, Jerry. Yes. I've not always been. Okay. But I've grown to be. Okay. And how has your faith impacted your medical education journey? You've walked us through such an amazing journey. What impact has your faith had on that? I think faith has always been there in the background. Yeah. for instance, my mom is, God bless her, so very prayerful woman.
Yeah.
She would dedicate days of prayer for her kids. At times when I crossed her, she would call me good for nothing. But she meant well.
Yes.
So as a doctor, when I went home, when I'm now a paediatrician, there would always be a few mothers with kids. When I went to see her, there would be a few mothers with kids.
Yes.
For me to help.
Wow.
So that act of charity.
Yeah.
Seeing them, some of them I would look at them, make a diagnosis, give them fare to come to Nairobi.
Yes.
And I link them to care.
Yes.
Some of them I would give money to just pay the medicines.
Yeah.
Or even to just buy food.
Yeah.
My mom taught me charity and patience, because sometimes I'll find time is running out.
Yeah. It's
the end of our visit and she calls me to see this mom and people are already in the car, ready to go.
Yes.
And I'm saying,
I need to go.
I need to go.
Yeah.
Mom, can't you see?
Yes.
But for her, she taught me patience, charity.
Yeah.
And especially charity, because even at the worst times, when we had just this one bag of flour, she would share.
Even though you guys are a full house.
Yes, she would share. Right. So with time I've learned to share with not just knowledge, but also material. And particularly what I can share most freely, my skills.
Yeah.
Yes, I share those happily. And also like to see the face of God in every patient. Yeah. Every parent.
Yeah.
That's tough at times, especially where they are not being friendly to you or they are being difficult.
Right.
But at least see the child as an innocent angel. Pray for wisdom. I do. Yeah. And that's how I've grown to practice, patience, prayer, respect of my patients, pray for them. Yeah. Wow. And hope that that achieves good results.
Yes. Yeah. It's just an amazing thing to have seen how your faith has played out over the years, how your love for pediatrics and your love for learning has played out. And I've absolutely loved this conversation. I know at the beginning you're like, I'm not a storyteller. And then you've gone ahead and told us some really interesting things. And, I am so humbled and I'm so grateful that you took the time and you've shared this with us. I know it's going to encourage someone. So thank you once again, Dr. Mbuthia. Thank you for your service. Thank you for your commitment. Thank you for always being intentional in sort of just also nurturing those who are behind you and setting a ground for the rest of us to be able to pass through. We keep talking about the shoulders of the giants and the one we are You are one of those guys who's you're one of those guys. Yes, metaphorically. You're one of those people in the field of pediatrics in Kenya on whom we have stood on your shoulders alongside many other fantastic pediatricians who've gone before us. And so I want to take this opportunity to honor you and thank you. Thank you so much.
Thank you, Jerry, for bringing me onto your podcast.
Yeah.
And for bringing the stories out of me. Thank you so very much.
Karibu sana. Yeah.
Yes.
And is there a way that people, should they want to get in touch with you, is there a way that they can be able to reach you either through email or a social media handle that you might have in case somebody has a direct question?
My email is best. I don't have a media handle.
Yeah.
Social media handle, but
we will work on that one.
Yes, Jerry, thank you. I'm always learning and I'm willing to learn.
Yes.
So it's jbuthia@africaonline.co.ke.
Okay.
Lowercase JMBUTHIA.
Yeah.
Yes.
Okay, will do. And I'll put that in the notes as well. Thank you once more. And for those who've listened to this conversation, I look forward to hearing what you have to say. We want to hear your feedback. And I know Dr. Mbuthia will also want to hear from you. So please make use of our social media handles, the email, and also the way to get to Dr. Mbuthia. And until next time, bye everyone.
Bye.
I'm so glad you stayed tuned. Please get the word out and share it with at least 3 people. Make this episode like a chain letter. Share it, share it, share it. Come back for the next leg of our safari where we'll be talking about...
For me, I was like, I want to be a psychiatrist,
Yes.
but I also want to deal with children with special needs. What is it called?
This thing. That one.
That one. That is 2 things. When I was doing my dissertation, I knew this is it.
Yeah.
As I was reading around doing the literature review, I'm like, this is it for me.
Listeners are advised to use their own judgment and discretion when applying any information discussed in this and all podcast episodes to their specific situation. Always seek the advice of a qualified professional if you have any concerns or questions regarding a particular subject matter. You can find this and other episodes of this podcast on our website at www.fellowshipsafaris.org. You can also find all our episodes on all podcast platforms. Reach out to us on social media as Fellowship Safaris on Facebook, Instagram, and TikTok, and our Twitter handle is @fellowshipsafar. You could also send us an email on fellowshipsafaris@gmail.com. We look forward to hearing from you and interacting with what you have to say about the Fellowship Safaris podcast. It takes a village to make this podcast. The executive producer and original music is done by Mokavi Maweu. The sound engineer is Tevin Sudi with thanks to AQ Studios. Graphic design was done by Benjamin Mboya. We would like to give a special shout out to Josephine Karianjahe and Melissa Mbogwa of Africa Podfest. All rights reserved by Dr. Jerry Karianjahe and the Fellowship Safaris podcast.